Hello, everyone, and welcome again to the ASWARA on Air Voice Clinic. This is our eighth session. Thank you for joining us, and we will be exploring more um, on the vocal tract. And today we will be looking at the lips, and we also have my colleague Rat, which will be talking about vocal paralysis. So let's welcome Rad. Welcome, Rad. Nice to have you with us again.
Hi, hi everyone.
Yes, and also viewing with us, of course, we have another one of our colleague. Peng is also here. Hi, Peng. I love that hairdo, Peng. So how is everyone doing? Good? Yep. I hope everyone is doing fine, and now more people are getting a bit more busy that we can finally go and do our work a little bit in the office. Yeah, so a lot of transition periods now. Everything has to be readjusted. We have all adjusted ourselves to being very comfortable doing things from home, and now we are adjusting ourselves back again to partially going to the office and partially at home, and then slowly moving into doing everything back as usual. And it seems that cinemas and shows can. I think they will start very, very soon. I see a lot of faces smiling when the word cinema comes up. So I don't know. So let's look what comes ahead. Well, I hope you guys are making progress with your using your voice, whether you are using it for speech or for singing or for whatever it is. I hope you guys are taking care of your voice and getting more knowledge on how to work with your voice. So yeah, throughout this session, if you have any questions, you are most welcome to um, ask at the end of the session where we have Q&A sessions. And also, if you would like to be in touch with me or together with of any of my colleagues, you are most welcome to email us as well. Yeah. So yeah, feel free because we would love interactions from you. If you have any questions throughout your singing or your acting and so on. Remember, using the voice isn't only for singers. Every one of us use our voice, so it's important for us to know about voice care. So last week, I did a revision about what we have gone through. So if you remember, we talked about power source filter, and then we talked about the larynx, and then we also talked about the thyroid cartilage, the cricoid cartilage, the tongue, the jaw, the velum. Now, I understand the velum might be a tough one for many people because it's inside. It's very, very difficult to control the velum. Now, if you have any questions on like how to work on the velum also, we can still do it today because today I'll be covering about the lips, and it's not a very large topic to cover because the lips is out front. Anything which the figures are out front, it's easier to teach and to cover and to master it. But anything which is inside, which is difficult, next month, in the month of July and August, we will be covering more difficult topics such as the true vocal folds, the false vocal folds, and all the other muscles. So that one requires a little bit of attention, and I will spend more time, especially with the false vocal folds um, retraction, because that one is, it's easy to understand the concept but very difficult to master because I have students even after 6 months still figuring out are they really retracting or they are not retracting, because it is a very, very small muscle. It's there, it works for you all the time, but yet we most of the time we do not pay attention to it, what it's doing. Yeah, so we will cover that next week, and for sorry, in next month, in the next few sessions. And also what will be interesting for you in next month's topic is that we will have another guest colleague of mine who is based in Germany. He is popular with beatboxing. he does beatboxing, and he also coaches a cappella, pop, a cappella, and jazz choirs in Germany. So he will join us on one of the sessions, and we will be talking about beatboxing, if you're interested about beatboxing, and seeing what muscles work during beatboxing, and yeah, so on. And he will tell more. So he will be one of our guest speakers for next week. And as usual, Peng will be along with me, Rat will be along, and also Dr. Ashwini. So we have 4 panels with me next month. So it'll be exciting. But only thing to let you know is that on the 1st of July, yeah, I think it's on the 1st of July, the first week of July, we will not have any session. Yeah, we will resume on the 2nd week of July. Anyway, we will text you all with the updates. All right, so let's get started. So let me put up my slide. Okay, is this sharing or not yet? This is not view, hang on. Just give me a moment. Let me figure this out. All right, and so we have here, so the slide is playing. Is it playing on your side? Yes, it is. Okay, so we will be talking today about the lips and vocal paralysis. So, and of course, we welcome our guest speaker, my colleague, Miss Sirirat. She is a speech and language therapist at the Bangkok hospital in Bangkok, Thailand. Yes, and so we all have different lip structures. Now, is it clear on your screen? Because on my screen, it's halfway. Yes, I can see it now. All right, good. So you can see some people have full lips, some people have heavy upper lips, wide lips, heavy lower lips, and so on. All right, but in general, all the lips work the same. So let's have you have some exercise. Now, you guys always, have you seen those commercials? Let me adjust my screen. I'm trying to adjust my screen that I can see you and at the same time work on my slides, because sometimes I can't see you and I can only see the slides. So let me see if this is working. Now tell me, do you get it clear like this? Is the screen showing full? All right, fantastic. So now, you guys know that sometimes you have that chewing gum thing, right? Which tells you you take chewing gum and then you chew and exercise your lips and you look younger in your face and so on, right? So for us singers, now this is a scenario I find in Malaysia when I'm teaching, is that sometimes our singers and our actors are like ventriloquists. They always speak to you this way. They don't really open their mouth when they speak or when they sing. So as a result, when they sing, you hear everything join in together and you can't really make up what they're singing. And singers sometimes ask, why do I sound blurry? My speech is blurry, or why my voice is not out there? Why is it soft, and so on. So, but have a look at your lips. Now, I'm one person which I use my lips a lot. Sometimes, if you look at me speaking in the video for hours, you may find your lips are getting tired, because I love to use my lips a lot when I speak. The lips help me get clearer pronunciation and to enunciate all my vowels, all right? And it helps me also with the tone color that I'm singing. So for those of you who want to know how to change your intonation, your tone color when you're singing, pay attention also on the lips, because the lips is also part of the filter. If you can remember what the filter, what are the filters? Can you remember? the vocal tracts above the true vocal folds. You have the epiglottis. We have not covered the epiglottis. Oh, we did, right? We did the wide and narrow. Yes, we have that e e e e. It modifies the sound. Wide sound gives you darker sound. Narrower AES gives you brighter sound. E e oo right? And then we also have your tongue. If your tongue is forward to the front, it's clear. But if your tongue is at the back, you get blurred tone, right? Forward tongue, backward tongue, not very clear, right? And also the velum. If the velum is low, all sounds coming out from the nose. If the velum is high, then all sound comes out from the mouth. You get a brighter, a bigger sound. I shouldn't say brighter, but you get a fuller sound, a clearer sound, because everything is coming out right from the mouth. And also the jaw. If you have front jaw, right, forward jaw, or mid, or back, or even drop jaw, it alters the sound a lot. So the lips is also part of the filter that will alter the sound. Remember, muscles work as a group. So in order to produce, maybe say for a single syllabus, multiple muscles will have to work together to produce that sound. So in 1 second that you're talking, to produce just one sound, multiple muscles are working together to get that particular sound. All right. So now let's look at the lips. So let's all try together. So you make a silly face and protrude your lips and say, "Oh, look at that cute baby." Now, and all of you to try. Now, in voice signs, you can't be shy. A person who is shy to do all sorts of silly sounds and silly faces will find it difficult for them to sell themselves as performers to get the message across. Okay? So this is something which I find in Malaysia. We want to perform, but yet we are shy. They want to be on stage, but they are shy a lot. Okay, so a lot of it comes back to how we are trained. Because as we all know, our Asian culture has trained us to be super polite and never show out your full potential. And as soon as we show our full potential, or we're doing something out of our comfort zones, we do not feel comfortable. All right. So in voice signs, in order for you to be really effective in voice signs, you will have to really do things out of your comfort zone. Even when Joe and Steele have her courses, in one of the videos that you can watch, people ask like, why do people make all sorts of silly sounds and funny sounds coming out from her workshop? And if you think of it, all these sounds are your palette of colors on how you can produce various sorts of sounds in communication. All right. So let's try that again. Everyone, you have that Marilyn Monroe lips, and just go. It has to be protrude, yeah? Really protrude your lips like you're going to kiss an apple. Like this. So, when you're doing that, feel what is happening in the muscles. You have to be very aware. So to all of you out there, when you're doing voice signs, be very aware of what the muscles are doing. Okay, because now, when we listen to one another, maybe you have experienced this, you record yourself singing, and then suddenly when you listen to it, you go like, I don't want to listen to my voice, that's not how I sound. Or some people go like, no, that's not my voice, I sound much better than that. Or some people go like, oh, I actually sound okay. Now, because we listen, we can hear ourselves through two ways. One is from your bone conduction, and one is air conduction. All right. So, have more recordings of yourself to determine how you sound like. Right. So, why I'm saying that is because you got to feel how your body works. When you can feel how your body works, then you can be confident to replicate that same sound or get that particular sound that you want. So it's very, very important in the practice of voice science is that you will have to work those muscles. There is no way of saying that, you know what, I'll just listen to it and then I'll be able to get it instantly. No, there's no shortcut in this. It's just like physical exercise. You will have to do it. Just imagine if you're doing yoga and you look at the instructor, he can turn his body backwards there or turn the arms or do whatsoever, and then you'll just go like, you know what? If I watch it 100 times, I'll get it. I'll be able to do it. But when you try it, no, it doesn't happen. So the same thing with voice science. It's a lot of practice doing it again and again, and that's why, like, even for me, I have my mentors which I work with, and I mentor my students that I teach who are under me, and that's how it goes, right? So try that again. Do it again. Listen to the sound that you're producing, right? What kinds of sound that you are getting? Is it a bright sound, or is it a dark sound? Or does it get louder or softer? Now, let's look at the other one. He's still sleeping, so you keep your lips in mid and say, oh, look at that cute baby. Oh, look at that cute baby. Right? And we try and just sing. E-ah-oo. E-ah-oo. Now pay attention again. How does it feel on your lips? What do you hear? Is it louder or softer? Is it brighter or darker? Right. And let's look at the third one. He wakes with a giggle. Your lips spread into a smile. Oh, look at that cute baby. Oh, look at that cute baby. And let's try and sing. E-ah-oo. Let's do it again. E-ah-oo. Now let's try and do all three. Protrude our lips on E-ah-oo. E-ah-oo. Mid. E-ah-oo. Spread. E-ah-oo. Let's try and sing Nagaraku with the protrude lips. Let's try it. Let's say go. Nagaraku. How about mid? Negaraku. And white. Negaraku. So how do we feel? What do we hear? Do you hear the difference? Now all of you will have different sensations. What will help you is you jot it down. What do you feel? Because some people will have slightly different. Okay, so if you I'm about to give you the answer right. No, I'll save it for later. I'll move on to the next slide first. Okay, so look. So now we have parts of the lips here, and we see the different figure options. So we have protrude lips. Can you hear, even while singing happy birthday with that, the do sounds very different. It's so different, isn't it? Just with do. Right? So sometimes when you sing in the choir, when a choir sings together, sometimes you find that why some choir sounds really nice together and some choir just sounds like, they are singing the right pitch, they're singing the right notes, right words, but they just don't sound together. Part of it is how they shape their vowels, and this is this is quite of a challenge in Malaysia, because although Malaysia is one country, but we all speak different mother tongues. Some people are more into speaking English, some people are more into speaking Chinese, in the Malay, or Tamil, or any other languages. So in Malaysia, although we speak the same language, but we all have very, very different accents. And that's because how we work on our muscles, our vocal tract, our filters, particularly our filters, how we work it are very different. Because if you speak in a language that has a lot of nasal sound, you will shape your sounds more on the nasalized tone. For those who use a lot of retroflex, t, the T will be different. All right. You can experiment that when you have your what is this? Your GPS. You try and put it in different nationality sounds. I've tried it. You put a Western way, it tells you turn left, and you put from India, it tells you turn left, and you put in the Philippines, turn left. So you have many kinds of different sounds, but it's all telling you turn left. So that's an example. So when you are singing the song, so if you are singing Italian songs, pay attention at how Italians shape their vowels. When you're singing French song, pay attention on how French shape their sounds, their vowels or their words. Remember, the French has the R that go, which is a flutter of the velum. So if you can control and flutter your velum, you get that R, 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 R. All right. So that's their R, R. The French don't do French, isn't it? French. They will say that French toast. But the Italians will roll on their R's, like risotto, isn't it? Round. Or the English, sometimes you have English which has round, but some of it just go round. How about in our languages, in Malay? How's the R? Do you say rumput or rumput? And how about say for our friends in Thailand, which even have more complexity because they could change the vowel sounds, right? So for our friends in Thailand, even more, like the S and the R behind of the words could be substituted as a shortened sound like a D or a T. So this influence a lot in how we pronounce our words. So yeah, so and the lips is part of it. All right, so let's carry on. Okay, here, and this is a video. So now you will look at the lips. So it's good to know a little bit of the muscles because it's actually a sphincter muscle. So this is called the orbicularis oris. Orbicularis oris. And you have some other muscles that control it, like the zygomaticus minor, major, and the risorius muscles. So these are all muscles that help you shape your lips. Right. So so the primary muscle of the lips is the orbicularis oris. So it encircles the mouth. It is a sphincter and is apparent in puckering the lips. All right. So a number of muscles come into the orbicularis oris from different angles when you pull your lips. So those are the muscles like the zygomaticus minor, major, risorius, in which you will see in the video, and the video will tell you more. And this is a video which I got it well on YouTube. Now when you're looking on YouTube, it's very important to look through which videos are good and which videos need more improvement, because you need precision. Like what I say, voice science is science. It's precision, because everyone is talented if you know how to use your voice properly. Like I say, everyone can sing. None of you will be singing out of tune if you pay attention on how your voice works, because everyone walks a straight line, isn't it? If we draw a straight line, everyone could see the line and walk, because you know how to use your legs and your eyes to guide you. The same thing as well as your voice, but because we don't pay attention to how our muscles work to produce sounds, and that's why we go off key, right? And I will talk also about how we solve problems when people are singing out of tune, and that's my favorite topic when people come to me and say, like, you know what, I'm tone deaf. Oh, I love to work on that case, because I've helped many people overcome that, and they are not tone deaf. It's just the small precision of moving the muscles that needs to be looked at, and I really love that. So if you have that problem, do let me know. And so let's look at this video.
In this video clip, we will be discussing some of the muscles that are involved in facial expression. We'll begin with this muscle here, which surrounds the mouth, called orbicularis oris. This particular muscle is a sphincter-like muscle. It attaches to the maxilla, which we can see underneath, and also the mandible.
So those are all muscles.
Inserts into the mucous membranes of the lips. This particular muscle is involved in helping to open your mouth and also can help to close it as well. Radiating away from orbicularis oris, we have dilators. You can see that there are many dilators which radiate away from the mouth. Some which help to raise the mouth, or raise the lips, which I'll highlight here, these ones.
You all can try.
We have other ones that help to pull the sides of the lip back. And we have other muscles here which will help to pull the lips downwards or depress the lips. So I'll begin by discussing some of the muscles that we find.
Okay, so those are the important ones. And we move on to the next one. Okay, and here is, I'm going to just show you a little bit because these video clips are really, really good. Like what I say, if you want, just tag 10 people there and tell them why this video is important. Go to my Dr. Casey Broadway Facebook, tag 10 people, and I'll send you these slides. And it will help. Now, these are the ones on if you are having problems in shaping or you're teaching kids how to shape their mouth. This is a very, very good video. So this video goes entirely all the way from A to Z on how they shape each words, all right? And yeah, so that's the end of presentation for lips. So let me recap. So there are differences in vocal color with different lip conditions. The effects of the lips control are subtle. So protruding lips makes it darker. The mid gives you a very neutral sound, and a wide lip gives you a very bright tone. So some choral directors and operatic singers like you to sing this way. If you're going to sing, whereas pop will get you to there. Hey, but how about jazz? Jazz would maybe give you a mid. Tall and tan and young and lovely, the girl from Ipanema, right? So it's up to you on how you're going to shape it and your group. So if you're in a choir, if you're in a pop choir, perhaps they will be looking more on white lips. Desperado, you don't want to sing Desperado, why don't you? The same thing as well if you're going to sing O mio babbino caro, you don't want to be singing O mio babbino caro. All of a sudden, yeah, I know the classical people are smiling because it sounds very, very pop, and then you get all those slurring babbino caro. You want that O mio la donna immobile, right? And so on the jazz, you don't want to sing tall and tan and young and lovely. Or in choir, entreat me not to leave. Even though it's leave, but in choir you want leave because to get that unified sound. So all this, there is no rule in saying which is better than the other or which is correct. It depends on your group and who you're working with. If you're singing it solo, it's entirely up to you. No one can say that you're singing opera with the white lips and in a pop style, it's wrong. It's whoever that loves opera will tell you it's wrong. The same thing, whoever that likes pop will tell you singing, how do I get through a night without you? It's wrong. It's, yeah. So it's entirely up to you. Remember, in voice production, there's no such thing as a wrong sound. It's just because we're talking about voice science, we're talking about if it's healthy or it's not a healthy sound. Right. So if you have more questions about the lips, I'll be happy to discuss with you at the end during the Q&A session. So in which now I will invite my colleague to share on her topic about vocal paralysis. And let me just draw up the slides for her. Hi, Rat. Are
Hi
you ready?
everyone. Okay,
Okay, hang on. Let me get. So maybe you want to start first about the vocal paralysis while I pull up your presentation slide. Where is it? Okay, found it. Okay, slideshow.
okay,
Okay.
yeah, okay. Vocal cord paralysis. Okay, vocal cord paralysis is when one or both of vocal cord are not able to move. So, it's usually caused by the nerve problem. Yeah, and okay, from the picture, the left side, yeah, this is a vocal paralysis.
So one
One
side
side of
is
uh,
paralyzed, one side of the vocal folds. So in case those of you who are new to this channel, let me show you again this one. This is the back and this is the front because we can see the arytenoids over here. So it depends if you so we know it as the arytenoids. The Australians might call it arytenoids, or the Malaysians would say arytenoids. So or the Americans would say arytenoids. It's the same thing. It's here. This is your true
yes,
vocal folds. This is the false
yeah,
vocal folds, and this is the front. Okay, back to you, Rat.
okay, yeah. About the symptom of vocal cord paralysis,
Mm-hmm.
yeah, the next slide have a problem in three parts. Like first is the voice change.
Mm-hmm.
For example, the patient have a hoarseness or breathy voice. Some patient lose of voice.
Mm-hmm.
Uh-huh. The second about the area problem, shortness of breathing when exercise.
Mm-hmm.
And this I think about the swallow problem. This is the key for the vocal cord paralysis because the vocal cord when you swallow the vocal cord
Doesn't
uh,
close.
doesn't close, and if the vocal cord cannot complete close, maybe have problem when drinking water. And about the symptom can be very depend on the degree of paralysis.
So it depends
Yeah,
on the severity, on whether it's how damaged are the nerves that
the
control the
nerve.
movements.
Yes. So if the patient suffer from this symptom of the vocal paralysis, you choose to see ENT doctor for uh, diagnosis.
Mm-hmm.
Yes.
Okay.
Okay. So the next about the cost. Yeah. Yeah.
Sorry, do you want me to play the video or stop?
Yeah. This is a video you can see, right? The when you speaking, the cord cannot complete close.
I'll play it again.
Yeah. So
Oh, sorry. I'll play it
uh,
again.
Okay, do it
yeah. So the voice is changed like the sound like a breathy voice because the air can leak
Mm-hmm.
between the vocal cord.
Yes.
Yes.
For our singers out there, what is happening is that one side is moving and one side is
Move.
not moving, so
Yes.
it's not vibrating. So to produce sound, it's
To
very
put.
very difficult.
Yes.
So do you move to the next slide?
Yes. Next slide. About the cause of the vocal cord, like okay, viral infection.
Mm-hmm.
Yeah, this the have the inflammation from infection may be affect to the nerve that control the through vocal cord.
Mm-hmm.
Okay, the surgery most common for the patient have the vocal cord paralysis like a carotid artery and thyroidectomy.
Mm-hmm.
Yeah, can because this surgery maybe can affect to the laryngeal nerve, recurrent laryngeal nerve.
Mm-hmm.
Yeah, and from surgery, the patient can have recovery. Some patient
Don't recover
uh,
from it.
can recovery, yes, partial. Some patient may be the injury, how to call, is a permanent.
Oh, okay. Yeah.
Yeah. Uh-huh. The have the time for recovery for the surgery, thyroid and carotid,
Okay.
1 year.
1 year. Yeah. So it takes 1 year
Yeah,
to.
can recovery if after 1 year, maybe permanent.
It all depends on how severe the nerves, uh,
Yes. Yeah, depend on the severe to the nerve
the nerve
paralysis. Yes, maybe onset loss of voice, but after
can
the
recover.
patient can recovery.
And it takes like a remediation and some therapy as well, isn't it? With
Yeah,
voice therapists
yeah, for voice therapy. Yeah, but some patient can recovery
by themselves.
by themselves. Yes. And the third is intubation for the surgery, when insert the
The tube,
breathing tube. Yes, when operation, or from the stroke, or some patient unknown cause.
because they want to save lives, so it's better to just insert the tube faster than taking care of the vocal folds, right? So sometimes it might cause
Yeah.
that speed of them putting in the tube to save your life. Sometimes it scratches or
Yes.
it damage the vocal folds, so that causes the nerve damage and in turn leads towards vocal paralysis.
Yes. Okay. Yeah. So about the treatment next, about the treatment, okay, voice therapy, and if the voice therapy cannot more improve, okay, recommend to surgery to put something to in the to vocal cord. Yes.
And through your experience, does surgery, is it 100% recovery chance?
For my experience, can recovery from the therapy.
Therapy is faster,
Yeah, from the voice therapy can help the patient,
yeah? Hmm.
but not uh maybe not more, but can compensate. The
Uh,
patient can make the sound, can speak better, have more sound, and can compensate no uh swallowing problem.
aha.
Yes, for my experience.
Okay.
Yeah.
All right, so that's about the vocal paralysis. So we'll have some words from ASWARA, and then we'll be back for your question and answer. So if you have any questions that you want to ask, remember we are open for you for all sorts of questions. If you have questions regarding the topics that we have covered, you're most welcome to. And also, if you have some other questions regarding your singing or some ideas that you have or you want to share your experience, we can do that after these words from our sponsors. Okay, so yeah, thank you to ASWARA that we have this voice clinic. So now we're open for questions, and let's take question number one from Mesha. So we have question after Mesha, and then we will have Hazrik. And the rest of you, if you have any questions that are coming along, please do let us know. So Mesha, carry on. What's your question?
Hi, doctor. Hello. Good evening.
Good evening.
I have questions about a singer.
Mm-hmm. Yes.
Okay.
Sure.
I want to know, is it very important for a singer about appearance? Is
Appearance.
it important?
You mean physical appearance?
Yeah, and about teeth. I want to put braces. So I want to know if it's important for me
Okay, well,
because I wanted to be a YouTuber.
YouTuber. Well, of course. Well, this question will be good for Dr. Ashwini. She'll be up. But if you ask me, as a person who mentors people for performance, I would say yes. A performance outlook is very very important, because that's the first thing, people will say, like, that phrase, like, don't judge a book by its cover. But come on, in reality, all of us judge the book by its cover. When you go into a bookstore, if the book has very nice binding, has very nice cover, even though it doesn't have really nice content, you will pick that book up and look at it inside. But a real book, a medical book perhaps, or any book that has good knowledge. Take, for example, a religious book like the Bible or the Quran, or any religious book. It doesn't have any nice content, any nice picture at the front. It's just a plain cover and says Quran or Bible. People don't pick that up because it looks boring, isn't it? Right?
Yeah.
And so that's the thing, how also we look at performers as well. So it depends. If you're a voice-over artist, which you don't have to appear on TV, and people just listen to the voice only, then you can just wake up with your morning hair and they want to just use your voice. But if you are, like you mentioned, if I'm not wrong, you want to be a YouTuber and you would like to sell yourself, remember, you are your product. Like, for example, let me give you an example. On my voice shows, when you come, you always see this golden background, because that's the theme. So everyone, when they come on my show, in terms of the voice clinic, they will see this golden theme. And yet when they go for my other shows, I have different things. On my lectures, on my ASWARA virtual lectures, is always a red carpet behind. So that's how I brand myself and look at it. So yes, for me, I would say appearance is very very important, and you will have to brand yourself to what you want people to recognize you as. For example, braces or no braces, for me, that's fine, because these days braces are also very beautiful. In fact, it can be also a trend. So it depends on you to choose what sort of braces that you want to put on, and Dr. Ashwini will be able to advise you on the type of braces. Maybe go to her, because she's a performer as well as a dentist. Maybe she could fix you up with something, and you will still look the same. So braces or not, look at it. Now, if you remember, I don't know whether you are you can remember the show called Betty La Fea, a Mexican movie, right? That girl with the braces that can't be accepted by a lot of her colleagues. She's not accepted by her colleagues in the show, but we all love Betty to pieces. We all love her. And as soon as Betty takes out the braces, we go like, no, this is not Betty again. So outlook is very very important for me. Braces or no braces, it's totally fine. It's how you present yourself. Groom yourself well. Put on your signature hairstyle, your signature costume, your dressing, how it is. And many people, when they do YouTubes or they put in videos, I get videos as well from students for their virtual choir. They are not aware that the background is really really important. Some people put the background with, you can see at the back, they're hanging all their socks, their underwear, and so on. And that video will be online. And that's how people will remember that, or your pots and pans at the back. They can at least put like just a cloth to cover or something. So that's very, very important if you're talking about image for YouTubing and so on, how your video will be perceived. So that's why for me, I tried. Now last week my background didn't work. It kept on because of the color. I was so stressed. I can tell you. After the show, I was like, dang, it didn't work. It revealed the curtain behind. So to that extent, how for me how particular it must be, right? So yes. So getting back to your question about that, it's totally fine. So I hope does that answer your question?
Yes, Dr. Casey. And Doctor, I will be studying in ASWARA, Asasi Seni Creative, for music.
Oh, that's wonderful. Welcome to ASWARA. Now, I tell you, when are you starting that?
Next week, 1st July.
Next week, so you'll be online, isn't it?
Yeah.
Okay, so you make sure when the term opens, you come and see me and say hello during the choir rehearsals.
Sure, Doctor. So will you teach us about voice and all that in ASWARA?
If you are in the choir, yes.
Because I wanted to do music course actually. So will you be there?
Well, okay, I tell you what, yes, I'll be there. We can speak privately after this conversation. We will help you out. But welcome to the
Okay.
ASWARA family. It's nice to have you with us, Mesha.
Thank you, Doctor. Thank you.
Who are the ASWARA people in here? Raise up your hands and wave hello to Mesha. Yep. So you see
Hello.
Okay. So all right, Mesha. So I hope that answers your question. We move on to our next question. So from Hazrik. Hello, Hazrik. How are you there?
Hello, Doctor. Hi, Miss Sirirat. Good. I'm fine, thank you. So I would like to ask about first question is, what does it mean by darker voice? Is it a deep voice? And then the second question is that what is the importance to shape our lips? Is it to make our voice nicer or clearer? And then in terms of a singer, so a good singer will they combine all those shape of the lips? Okay, that's all.
Okay. Yeah, Hazrik. Sorry. So the question is for me or for Rat?
Yeah.
Your question number one again?
Again, please. Sorry.
The first question is about what does it mean by darker voice? Is it a deep voice?
Darker tone, intonation, your tone. Darker voice. Well, darker
voice.
So when we are talking about voice, see, we always put voice with colors, so it's easier for us to have a reference. Remember that music, you can hear it, you can feel the emotion, but you cannot touch it and you cannot see it. So we need something to visualize for us to aim to get what we want. So one of it is, so when we are talking about darker sound, we are talking about sounds which are more mellow, more of a rounder sound, and it usually, I'm not saying all the time, but usually associated with lower pitches. All right, but it doesn't mean that a high pitch cannot be dark. It can be also dark, but usually with lower sound. So a dark sound can be a pitch which is very, very broad, very, very gloomy, which has gives you a sense of thickness. So that can be a darker sound. Yeah. So that's number one. And number two, you were mentioning about, does all singers use combine all the lips and all the other muscles? Is that correct?
Yeah, is that a good singer will do that?
Well, a good singer will be able to choose the right combination of muscles to use to produce the desired sound. Because if you're singing a pop song, you do not want to sing this way. Although if just say if you're classically trained all your life, you keep on singing, but when it's time to sing pop in the karaoke, you know that when you go and sing, for example, you're singing what song? Let's see, what was that? Baby, lock the door and turn the lights down. No, you don't want to sing. Baby, lock the door and turn the lights down low. It becomes classical. So a good singer will know how to adjust on which of the vocal tracks to use, which figure, whether you need protrude lips or mid or wide or high larynx or lower larynx. When you sing classical, you want slightly lower larynx, not too low, because if it's too low, it will produce uncontrolled vibrato, and we don't want that as well. And also, like for example, vibrato. Vibrato is one topic which I wish to talk about in the future as well, because always there's a misconception about vibrato. So yes, a good singer will know and will utilize all the different combinations of vocal track to fit the sound that they want to produce. Right? And I remember there's one more question. You have 3 questions, right? And what was the...
No, there's only 2 questions.
Oh, 2 questions. All right. Okay, so I hope that answers your question, Hazri.
Yeah, thank you, Doctor.
All right. Anything you want to add for this, Rat? Okay, so okay, we have Arif and also we have Pasha. So let's have Arif first. Your question, Arif.
Hi, Doctor.
Hello.
Thank you for the session.
You're most welcome.
Okay, and I just want to ask one question about the vocal paralysis just now.
Vocal
Since
paralysis.
it's very dangerous for a singer to have that vocal paralysis issue, so what is the symptom, or I mean, what is the cause? From, I mean, like either than the illness of the voice, and other cause, is there any other cause that will cause the vocal paralysis?
Okay, thank you, Arif. Rat, would you like to take that question?
Yeah. Again, please.
What are the other causes and symptoms for
the causes.
vocal paralysis?
The cause from the vocal cord paralysis, the most common from the surgery and infection. Yeah. So another cause, like unknown, I think this is a rare, not see more. Yeah, mostly from the surgery, carotid surgery, thyroidectomy, or from the stroke, and from the infection.
Oh.
Yeah, this is the most common.
Right, so it will be getting worse if we push our vocal to sing and everything. If we have the symptom,
yeah.
If we have the symptom, then if we push our voice to sing and all, still singing, it will make it worse, is it?
Well, I think I think that one is it depends on whatever symptom, isn't it? Right.
Yeah.
You have to know what are the symptoms, because it can be other kinds of problem like vocal modules and so on.
Yeah.
So the advice you should rest. That it's better to rest, right? Then you push the voice.
Yes.
Right.
So, Arif, right? So
Yeah.
I think in addressing that question on a perspective of a singer and a singing coach, so I think you will have to monitor on how the condition is. Okay? The first thing is to monitor the condition, because sometimes it can be just a mild condition of just some sweat.
Yeah, because of flu and all that.
Yes, correct. But remember, because these muscles are so small that one wrong move can lead to some other problems. For example, I had a consultation from a patient from one of the hospitals in KL. She came to me because she says that no doctors would want to deal with her, because they gave her like come back after a year and do some exercises. So she was very desperate. She found me online. So she had vocal paralysis.
All right.
So the way I deal with that is I use graphs. I know it's very it's a very new thing. I use graphs. In terms, I use visual stimulation to help coordinate the movements of the vocal folds in order for it to move. It didn't it depends also from person to person. I was lucky that person managed to solve it, managed to get her voice working, and I think about 6 months, within 3 to 6 months.
It will take that long as well, is it?
Well, she didn't. She wasn't regular. She came in like every 2 months, once, 2 months, once, like that. But I think we contacted her after 6 months to ask, and she was fully recovered, and that was one of a lucky case. But whatever it is, when you're singing, make sure that you can recognize between pain and muscle ache. If it's muscle ache, then that's fine. But if it's pain, then you will have to get it sorted out. Yes.
Yeah. All right, sure.
All right. I hope that answers the question. You're welcome. And we have one more question from Pasha.
Hello, Dr. Casey.
Hello.
Thank you for having this session.
Most welcome. Did I pronounce your name correctly?
Yes, it is Pasha. You pronounced it correctly.
All right.
Okay, so I have a question. I have two questions, in fact.
Yes, sure.
I have actually heard, right, from some article and also advice from certain people from the music background that they said that we shouldn't use falsetto and that we should also avoid falsetto, where in fact, in my view, it's actually a kind of technique, isn't it?
Yes. So is that your first question?
Yeah, that's my first question. So why should we actually avoid falsetto? That's the first question.
Okay. So maybe I answer the first question.
Okay, cool.
So falsetto, well, if you take up the Estille voice model, falsetto is part of a voice quality. The Estille falsetto is quite different from the normal falsetto of what we perceive out there. So for example, if I'm going to sing, now a lot of us will say that's falsetto, but in Estille, that is a tilted thyroid with thin vocal folds. It's not a falsetto. A falsetto in Estille will be, it's breathy, right? And there is some truth in not using falsetto if you're talking about breathy, breath-wise. It depends on how you're using it. So what we want to avoid is a lot of breath being pushed, because when a lot of breath is being pushed to the vocal folds, it dries out the vocal folds, and that's where problem starts. All right, but nevertheless, we use falsetto, for example, in jazz songs. Tall and tan and young and lovely. In Estille terms, that is also falsetto. So I can even falsetto at a low sound. So for the Estille voice model, that is falsetto. But if you were to look in the classical style, which they say, that is falsetto. Well, of course, anything which, if you prolong using it, which is, it's not in your natural state of sound, for example, for male, that is not in your natural singing voice. If you prolong it and use it, you abuse that, it will lead to problems. So you will have to use it and to know what are your limits. So I would not say it's bad using falsetto, but knowing when to use falsetto, and also what sort of falsetto. If you're talking about the Estille sort of falsetto, it's okay if you're singing jazz because you want that voice quality. That's fine. But for example, for a male singer who want to sing high notes but they cannot reach, and all the time they go to falsetto, and choral directors face that problem a lot. If the ladies are not singing enough, we got a falsetto in that ridiculously high sound to get that big sound. In the end, we have a risk of getting vocal problems as well.
Oh, okay.
Yes.
Like Mariah Carey used to use a lot of falsetto, right?
Well, she uses that a lot of tilted vocal, tilted thyroid, thin vocal folds, and she whistles to that high range. But you notice that she doesn't use that all the time. She belts. She uses speech quality. Because each time when we sing, we mix and match different voice quality. Because if we use just one voice quality throughout, just imagine if I'm going to sing for you, Mary had a little lamb, Mary. Throughout the whole thing, no one will want to listen to it. So in reality, we mix and match different voice qualities. So coming back to your question, whether it's safe or not, yes, it's safe if you use it just for effect or when you need it, but not to sing in falsetto throughout the entire song. But having said that, you have singers, for example, like Frankie Valli and the Four Seasons, right? Big girls don't cry. That is a certain sound that they produce. But remember, some of them are singing in a counter tenor range as well, which their voices are really high.
I
Okay,
see.
so,
Okay.
does that answer your first question?
Yes, it does. Thank you.
Okay, and
So,
your second question?
okay, yes. My second question is, what's the main thing that we want to actually take note when we do a warm-up exercise besides taking note on the pitching and the rhythm? What else do we need to watch out?
Okay, good question. So, whenever we warm up our voice, we are actually preparing our voice to work. So remember, we need to prepare the muscles to work. So if I normally do is that I do the siren exercise. You know, siren for me is very, very important because when you're doing siren, you're actually moving your what do you call your larynx up and down, tilting the thyroid cartilage and untilting it. So that in terms is actually pulling and stretching your vocal folds. So that will give you different tone color, and it helps you to regulate all the muscles to start moving. So aside, I think for me the most important thing is to get all the muscles moving. Some people do some stretching and so on, but warming up can be just as simple as doing your sirens first, starting from just a comfortable range, then later moving up to as high as you can at your most comfortable vocal effort. Do not try to go anything which is beyond. What we want is to let your thyroid cartilage tilt as much as possible, especially for boys. Yeah, for higher notes, you need it to tilt, and then also to work it with vertical. So we look at that. First thing we do is we get it to move first, so that high tilting and non-tilting and stretching of the muscles. After that, for me, I go then into the desired sound that I want. So if a singer wants to sing a classical song, then I move into the other parts of the filter that works on the classical one. So the first thing I did, the siren, was to get the source moving. I don't have to work on the breath because we breathe since the day we are born. We don't need a ventilator to breathe, so we don't work on that. The first thing is we work on the vocal folds. We let the source vibrate, like how Arif is strumming the guitar. He lets the guitar strum. That's how we do it. Then next we work on the filter. After that, I work on the filter. So if they want to sing classical, I work on the lips, the jaw, and so on to get that sound. If they want to sing pop, then I work on the cricoid, because they will need to belt, musical theater people. So those are the things I work. So I don't look really at the rhythms and so on. I go first is to work the muscles to produce sound comfortably. Second thing is to shape what sort of sounds that I will prepare. For choirs, I get them to sound big and round, and most people will say like the head voice and frontal projection. These are the things I work. And then lastly, rhythms and so on, I work when the songs are needed. Yes, does that answer your second question?
Yes, it does. Thank you so much, Dr. Chrissy.
You're most welcome. So do we have any, we have time to just take one final question if there is? Okay, looks like there's no question. So thank you very much, everyone, for joining us here. So remember, so next week there won't be a voice clinic, but the week after we'll have again, and we have more interesting topics to come. And we are moving now, as we see, we covered the filter, so we'll be moving more now towards the other muscles inside. So it will get more interesting, and the more as we go along this vocal clinic, if you've joined us, the more you will see that we will be able to discuss more about the singing, because the first few series, it's difficult to talk about the singing mechanism, because you are just being introduced to the different vocal tracks. But as we go, more of the vocal tracks now, you will begin to understand when I say when I quote certain vocal tracks on how it sounds and what works and what doesn't work and so on. All right, so thank you very much, everyone. I wish you a good weekend, and I will see you guys next week again. Thank you, Rat, for joining us, and we'll see you 2 weeks from now. Take care. Good evening. Bye-bye.
Okay, bye.